Okay, perfect. Thanks, guys. Come over here, Principal. Got it. You got it. Okay.
Good morning, everyone. Welcome to Fort Lee, New Jersey. We're here with the backdrop here is school number 4, a school that we're very proud of. First, we're going to ask Councilman Harvey Sommer to lead us in the Pledge of Allegiance. Harvey?
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Thank you, Harvey. Welcome, everyone. We welcome Congressman Gottheimer to the borough of Fort Lee today on a very, very important issue. You know, it's not easy growing up in this world these days, especially if you're a kid, especially if you're going to school with all the various pressures that we face on a day-to-day basis. There are mental health issues that have been exacerbated as a result of the pandemic and all sorts of other pressures that we deal with on a day-to-day basis. Never, ever before, at least in my 62-year lifetime, have funding for mental health issues been more important. And now there's the prospect that that funding is going to be cut. And the resources that were once provided to these kids that need that type of assistance is not going to be available as it once was. So we're here to hear from Congressman Gottheimer and his fight to make sure that that funding stays in place to protect our kids. So without any further ado, with great privilege, I introduce our Congressman Josh Gottheimer.
Thank you so much, Mayor.
Thank you, Congressman.
Thank you, Mayor. Thanks. I can't thank the Mayor enough for his incredible leadership. We're actually at not only number 4. This is home of the Penguins. Principal, is that right?
That's correct.
And not to like rub it in here, but the Mayor was student of the century. Named student of the century at this school. Is that accurate?
It was a weak list.
Student of the century. And I'm going to put in now, and I don't know how to get this done, but I'm going to start working on this today, that I think we should name this school after Mayor Sokolich for his leadership. That's what I think. So I'm going to work on that today. I'm adding that as an announcement to my speech today for the record. Very clear. And I do want to thank Councilman Sommer for his incredible friendship and leadership. Dr. Kravitz for our superintendent, Mike Rubino from the Board of Education, Doug Lopez and Kim Curry and Casey Knight have all been so helpful on the Board of Education, as well as Caleb Hurst, and Assistant Superintendent Colazo also has been critically important in helping lead this phenomenal school and this great school system in Fort Lee. It's great to be back here. It is Mental Health Awareness Month. So I thought it was really important that we get together, not only to thank our educators who work so hard every day to support the kids at the school behind me, but also to make sure not only they had a path to success, but to make sure their mental health is looked after. And that's something that I know is a responsibility of educators these days, as well as it is obviously to educate our kids. And as the son of a teacher, I can tell you I know how much they sacrifice to do just that. So when you look at the beaming smiles on the young faces here at this elementary school, you're reminded of just how important it is to invest in our future. We were just talking to one student a minute ago who's going on to college next year and who's studying political science, who's going to study political science, and we were talking about it. The fact is that everything you learn beginning in school. The educators are so critically important, but it's also tough, as we know, to be a kid these days. It's not like when we grew up, especially when Mark grew up a while back. The stresses that our children are facing when it comes to mental health are much tougher these days. According to the CDC, 1 in 7 children ages 3 to 17 are diagnosed with a mental or behavioral health condition. Think about how high that number is. 40% of high school students in grades 9 through 12 experience depression, with nearly 10% attempting suicide. Like, these numbers are shocking, and as a parent, scary. According to the New Jersey Department of Health, suicide is the 3rd leading cause of death among youth between the ages of 10 and 24 here in Jersey. These aren't just numbers, they're our kids, right? And they go to schools like the one behind me and here in Fort Lee and of course all across our state. They're our future. We got to make sure we take care of them and look after them. But with so much coming at them with online and social media and the overload of information that's available and how kids interact, that's different these days than when we were kids. Then, of course, came the pandemic, and over the COVID-19 years, we saw a historic wave of mental health challenges, including a 25% higher rate of anxiety and depression, with many of our students still feeling the effects today. The pandemic completely disrupted their routines, kept them out of the classroom, away from seeing their friends, exploring hobbies, and playing on their sports teams. Today, 37% of students with a mental health condition, 14 and older, drop out of school, the highest school dropout rate of any disability group. In 2023, the Surgeon General even declared youth mental health a national crisis. So it's worth us actually coming together to talk about these issues. And the good news is that we actually are willing to talk about them now. If you remember back in the day, you swept these things under the rug. There were stigmas associated. Now we know that mental health is not something you sweep under the rug. It's a real crisis, and it's a disease. There's the challenge of having enough medical care, of course, to deal with this surge. And that's one of the biggest challenges we have right now as a state and a country. Having enough beds, having enough doctors, enough caregivers, enough social workers, that's a huge challenge to be able to handle this. I talk to our hospitals all the time about the fact they don't have enough beds, especially pediatric beds. We know that those with access to mental health services in schools are 10 times more likely to seek care for mental health or substance abuse than those without it. So when schools and teachers and superintendents and principals and other administrators step up and help, it makes a huge difference. We must make these investments that are necessary. Yet somehow, for some reason, the Trump administration doesn't exactly see it that way. Instead, they cut $1 billion in funding for the Department of Education that helps our schools hire more psychologists, counselors, and other mental health workers who support struggling students. These are critical, life-saving investments I helped claw back and secure for Jersey as part of the bipartisan Safer Communities Act. It was a major first when it comes to federal legislation, and as part of the bipartisan gun safety legislation we passed and got signed into law, a key part of that helps rising mental health crisis affecting our children. These investments have had a broad impact, and they're bipartisan. That's the thing about mental health issues is, and the good news is it's not a partisan issue. These federal dollars expanded available mental health services to more than 40,000 students here in New Jersey, helping hire 68 new school-based mental health professionals over 2 years. Yet Donald Trump, for some reason, wants to whack those resources out. He wants to cut them. The Jersey Department of Education is in year 3 of a 5-year implementation plan, including investing $15 million to expand access to mental health professionals in our schools. Now the Trump administration is forcing our state to cut that 2 years early, to stop the program. And we got people worse. Some extremists want to gut funding for the Substance Abuse and Mental Health Services Administration, what you probably hear of is called SAMHSA. They want to cut that too. That promotes access to suicide prevention and mental health services, including to children, youth, and families. These aren't just cuts to programs. Extremists want to actually eliminate the agency responsible for providing mental health support to Jersey youth and families. It's a joke. I don't know why you do that. And how do they justify it? Well, they just say, I guess it was a priority of the last administration, but it's not a priority of this administration. So today we're going to fight back as soon as the large truck passes by. The health and safety of our children are a huge priority to me and to the people standing behind me. That's why I'm announcing new action to fight back against these cuts and to support our children's mental health, to ensure they can receive the resources they need to learn and thrive, to ensure every student has dedicated professionals ready to help them. Many leading organizations, including the National Association of School Psychologists, recommend that schools have a maximum student-to-school counselor or student-to-social worker ratio of 250 to 1, and a maximum student-to-school psychologist ratio of 500 to 1. But most states, including our state, with a ratio of 659 to 1, don't even come close to that. Again, it's 251 to 1 is recommended. We're at 659 to 1. So we've got a lot of work to do. The national average, of course, is actually, believe it or not, worse than Jersey, 1,162 to 1. So even though we're behind where we should be, we've been leading the way in our great state because we've actually invested in it. And now Trump is gutting that investment and cutting us years short of where we should be. Years short. And to me, that's outrageous. It's putting our kids and our children at risk, putting their lives at risk and their health and safety at risk. At the state level, our fantastic Assembly members, Lisa Swain and Christopher Tolley, have introduced legislation to cap the ratio at New Jersey school at the NASP recommended levels that I just mentioned. But as they both pointed out, we just don't have enough psychologists right now across the country or in Jersey to fulfill these positions, which is why these cuts are so devastating. Jersey will need to hire 63,000 more school psychologists just to meet the recommended level. Let's put that in mind, just to get where we should be. So cutting it and making it worse than we are will set us way back. These health professionals don't just help with chronic issues either. They provide support when there's a tragic death in the family or for a victim of bullying. Now, this is not all doom and gloom. I want to tell you some positive stuff to bring the sun out a little bit, what we're going to do about it. If we're smart and make strategic investments, we can make a huge difference for our kids. Especially, and that's why we're here during Mental Health Awareness Month, I'm announcing new action as part of my youth mental health strategy. First, asking for help is not a weakness, it's a strength. We must have trained professionals available to help our kids who need it. But as I mentioned, the shortages, that's why I'm announcing new legislation calling the Preparing for the Futures Act to create a national grant program to provide up to $8,000 a year to students studying to become school psychologists, to encourage our children who are going to school for psychology, our kids and our young adults, to actually pursue a path in psychology. This will help address the school psychologist shortage in Jersey by requiring these students to work at school struggling to meet the recommended amount. Second, with students spending more time online with devices, we need to ensure what they're doing is safe. Thankfully, we now have suicide prevention software that can track potentially dangerous messages or search students make online, which can help them prompt calls to parents if they see a problem or visit home. The technology is saving lives, but schools need help paying for it. So I'll be introducing the Saving Students with Software Act to help schools cover the costs of this life-saving technology. It actually flags issues online through technology if there's a problem and alerts the schools and will therefore alert parents and help address mental health crisis. I'm also actively backing Youth Mental Health Research Act to secure an extra $100 million investment in new treatments. We know that children who are struggling with mental health issues who get the care, we know it makes a huge difference. We also know that stepping in early will stop problems with a lot of students with drug and opioid addiction. So I'm leading the charge in Congress with 20 of my colleagues to secure the highest possible level of funding for SAMHSA in this next fiscal year. We've got to help our children, not gut these dollars. We need to invest, enhance suicide prevention and mental health. And introducing the Bipartisan Mental Health in Schools Excellence Program to cover 50% of attendance costs for graduate students looking to become school counselors. There are many things we can do to actually address this issue. We just can't sit back and watch. Just like we can't sit back with student athletes and watch kids get addicted to opioids. We've got to intervene early and make sure we help invest in our kids. Whether that's from child care centers to preschool to kindergarten, all this stuff pays long-term dividends. Slashing these dollars are not the right way forward. It will only make our country weaker and hurt our children. It's ridiculous and absolutely reckless. This is not partisan. These bills all have bipartisan support when you support our children. In the greatest country in the world, if we work together, put our kids' health first, we can solve this problem, as everyone behind me is so focused on here in Fort Lee, where I know they care deeply, have focused on this issue for years, and will continue to invest in our children. We should do that everywhere in New Jersey and our country, and I know our best days will be ahead of us in this great country. God bless. Thank you.